Joining us for today's briefing. Today we have Dr. Rachel Levine, Secretary for the Pennsylvania Department of Health. This briefing is being recorded. Immediately following the briefing, we will do a question and answer that will be in order of your RSVP to the event. Thank you, and here is Dr. Rachel Levine.
Good morning. Today, we are reporting 2,374 individuals hospitalized due to COVID-19 as of 8 a.m. 510 of the individuals that are hospitalized with COVID-19 are in an intensive care unit. 258 of the individuals hospitalized with COVID-19 are on a ventilator. Last Monday, I reported 1,735 individuals hospitalized due to COVID-19. So that's an increase of close to 650 patients hospitalized in 1 week. This number is rising rapidly and highlights the role that we all play in preventing our health systems from becoming overrun from COVID-19. Now, in terms of further numbers, today we are reporting 4,476 new cases of COVID-19 and 5,199 new cases from Sunday. That brings the total number of COVID-19 cases in Pennsylvania from the start of the pandemic to 269,613. As our data over the last week shows, Pennsylvania is seeing a higher rise in case counts than we have seen since the big pandemic began. Of our total cases, 68% are considered recovered, meaning that it has been more than 30 days past the patient's positive test or onset of symptoms. That number is decreasing with the high number of new cases. Remember, we continue to see many people who are considered COVID-19 quote-unquote long haulers, where a true recovery may take months as they continue to deal with symptoms from the virus. The statewide percent positivity, as reported on the early warning monitoring dashboard, is now at 9.6% statewide. Last week's percent positivity was close to 7%. This week's rise was one of the largest one-week rise that we have seen. In addition, 62 counties have percent positivities above 5%, 62. That's 10 more counties than last week. And to put that in perspective, it means that only 5 counties in Pennsylvania have a percent positivity below 5%. Another data point that we have been closely monitoring is the number of people who have reported going to a business or a large gathering 14 days prior to the onset of symptoms. For the week of November 1st through November 7th, now only 16% of people that have been asked that question have actually answered the question about whether or not they have frequented a business or attended a mass gathering 14 days prior to the onset of symptoms. This percentage continues to decrease, and more people are not providing this information as part of the case investigations. That's a real challenge for us. Of those who answered the question, so of those who did answer the question, 535 said they had been to a business establishment, and more than half said they had been to a restaurant in the 14 days prior to becoming sick. 615 of those individuals said that they had been at a mass gathering in the 14 days before they got sick. So today I want to highlight all of the things that we can do right now. First, we can answer the call to prevent the spread of this virus, COVID-19. We need people to answer the call when a case investigator or contact tracer calls them and provides them with information that can actually save someone's life. This includes the businesses that they have visited, the large gatherings that they have attended, and the names of their close contacts. We can answer the call by wearing a mask, which is a proven public health measure endorsed by medical experts, politicians on both sides of the aisle, and many others to prevent the spread of COVID-19. We can answer the call by practicing social distancing, avoiding large and small gatherings and staying away from people who are not part of our immediate household. I know that this is extremely challenging, particularly as the holidays approach. However, we are fortunate that 2020 has brought us new technology like these platforms that allows us to see our family virtually. If that is not possible for you, you can make a phone call, write a letter. Children can draw pictures for their loved ones to show that we are still connected, even at a distance. We can join the 485,000 people who have downloaded the COVID Alert PA app, a safe and effective way to alert you if you have been exposed to COVID-19. We have done very well with the uptake from the app, but we're looking for more than 1 million people to download the app. I certainly know that 2020 has been a difficult year, but we can get through this if we stand united together. It requires each of us working together, regardless of any of our differences. For those that are struggling, I want to let you know that help is available. Preserve PA is a COVID-19 crisis counseling program that will help you if you are feeling stressed, overwhelmed, alone, anxious, or afraid. That number to call is 1-855-284-2494. Again, 1-855-284-2494. And it is available in English and Spanish. What this virus, COVID-19, and the global pandemic has certainly taught us is that we are all interconnected. We are all interconnected. And it is our collective responsibility to protect our communities and our healthcare workers and our most vulnerable Pennsylvanians from COVID-19. And that has not changed. We can control COVID-19. And as always, stay calm, stay alert, and stay safe. And now I'm very pleased to answer questions. I'll turn things back to April.
Thank you, Secretary. When it's your turn to ask a question, you'll get a request to unmute yourself. Please go ahead and unmute. Our first question is from Ron Southwick from Penn Live. Ron, go ahead.
Hi, good morning, Dr. Levine. Thanks for taking our questions. I wanted to ask about the guidance you're giving schools. I know you've said repeatedly the last couple of weeks, schools will make their own decisions, but I just wanted to know, are you starting to advise more and more school districts to consider going to remote and to shift away from in-person education?
Well, so we are strongly recommending that schools follow the guidance that we have had available over the last number of months. So as you said, it is a local decision, but we do have specific guidance for schools depending upon the prevalence of COVID-19 in their communities, as well as the percent positivity. And what we're asking is that schools follow that guidance.
Ron, any follow-up? Okay. Our next question is going to be Levine from Beaver County Times. You've got a request to unmute. Go ahead.
Hi, thank you so much, Secretary, for taking the time. We've talked a lot lately about seeing the spikes in communities like Lawrence County, Beaver County, where we're starting to see, particularly Lawrence County, where we're starting to see in these rural areas that didn't see much in the spring and the summer, but now are just being inundated. Why are we seeing that, and what? How has the department been reaching out to those counties to provide mitigation?
So we are seeing increases now throughout Pennsylvania. The vast majority of counties in Pennsylvania are seeing increases in terms of their number of new cases. This is exactly the same pattern that we are seeing throughout the United States, particularly in the Midwest and Mountain West. But every state in the United States is seeing increases. I often say Pennsylvania is not an island, and so we're going to be reflective of the increases seen. Hawaii is an island, and they're seeing increases too. And so this is an issue impacting urban areas, suburban areas, and now more and more rural areas. It's because of the community spread that we are seeing throughout the Commonwealth. And your second question again?
The follow-up to that would be, what sort of mitigation are you working with these folks? I mean, it seems like these are areas where, you've got a lot of high school football. You have a lot of folks who aren't willing to consider wearing masks because of the politicization of it.
Yeah. I want to get past the politicalization of this public health issue. The election is over. The people have spoken. And so now it's time for all of us to come together to fight this virus. And that's why we're often saying, answer the call and stay united. So we're seeing increases again. It's not just congregate care settings. We're seeing significant community spread. And so now is the time that people need to come together and to wear a mask. It's a simple thing to do. We need people to wash their hands and to social distance and to avoid gatherings in general. But if they are at those gatherings, to social distance and stay 6 feet away. We have mitigation orders in place. We have mitigation orders in terms of restaurant capacity indoors at 50%. We do have limitations on small and large gatherings, particularly large gatherings indoors and outdoors. And we want people to follow that guidance. We want people to telework as much as possible. We want people to isolate and quarantine through their case investigations and contact tracing. And so as we do all that and we work together, we will be able to stop the spread.
Next up is Jim Melwert from KYW. Jim, go ahead.
Hey, Dr. Levine. There's a lot of angst right now that there could be increased restrictions, especially gyms and restaurants and some of the other businesses that were hit hard early on in the spring. Are there any plans for such increased restrictions? And if not, is there anything that you can say to kind of give more clarity to those businesses, such as data points you may be watching or anything that could possibly trigger restrictions?
Well, so we have no plans to go back to red, yellow, green, or any type of schema such as that. And so the best way that businesses can work with us in order to prevent anything from happening is to really do everything I just said. Is that we need to enforce and to work with limiting the number of people in a business at any one time to limit the capacity to 50%. We want restaurants are at 50%. We want people to wear a mask and to social distance and wash their hands. And so the best way that we can prevent any type of significant mitigation impact like we had in the spring is to do all of those things right now.
Jim, any follow-up?
No, I'm good, thanks.
Okay, thank you. Next up is Barbara Barr. Barbara, you have a request to unmute.
Secretary, thanks for the time here. A couple of months ago, I know Governor Wolf and you had a press conference with OraSure Technologies, a Bethlehem company, about a rapid antigen test that you could actually do it yourself, I believe. I was wondering if you have an update on their progress. There was talk about having it ready by the end of the year, and how important something like that could be to stop some of this spread.
Sure. So I know OraSure is continuing to work on all of their different tests, including the one that you mentioned. I don't have any specific details of when they will be able to receive their emergency use authorization from the FDA, but I know that all of that work continues. I think that the rapid antigen tests are really very valuable. We have the rapid antigen test cards that we're distributing to counties that are very impacted by COVID-19, to be used in nursing homes, to be used in other congregate care settings and in vulnerable communities. So I think that those type of rapid tests are very, very, very helpful. The gold standard remains the PCR tests, but these rapid tests, especially when used on symptomatic individuals, are extremely accurate and very important. It would be great eventually to be able to have a test that people can buy and to administer at home. And so we'll be looking for OraSure's test to receive its authorization from the FDA.
Just a quick follow. Any reason that we're seeing so many more cases now than at the onset of this in the spring?
Well, we had talked about for many, many months the anticipation of a potential fall resurgence. And that's what we're seeing now. It is really because of the change in the weather. And it's getting colder and people are going more and more indoors. Respiratory viruses like COVID-19 are spread much more, unfortunately, effectively indoors. And so we're seeing the fall resurgence that we have anticipated and we have been preparing for. It is a significant resurgence in Pennsylvania and throughout the country.
Next up is Deanna Durante from NBC 10. Deanna, you have a request to unmute.
Good morning. I wanted to first get your opinion on the action by Montgomery County specifically to shut down and make all schools go 100% virtual starting November 23rd through December 6th. Obviously, parents are up in arms about this. The concern is that they feel that there's been no community spread inside schools, no science to back this up. Do you agree with the plan, and do you think this will then slow down the spread come December 6th, or is this just the start of shutting things down?
It's impossible for me to predict the future. And of course, there is local control. So we support local communities taking action to stop the spread and doing what they feel is necessary in their communities. So I know that Dr. Valerie Akush is an excellent physician and has great public health knowledge. She has a great team with her. And so we support Dr. Akush. But they make, local communities make the decisions in their areas in terms of schools. And we really support the authority of local communities to make decisions in their local areas according to mitigation for what they see in their community. They have the best clue in terms of what's going on in their facility. What we're doing is looking at things statewide.
But the virus, we've heard over and over, doesn't have borders. So if Philadelphia closes their restaurants to in-person and Montgomery County leaves them open, that just has people from Philadelphia going into one county and spreading it. And then if you don't have kids in school, where are they going to be to then pick up the virus? Isn't this doing this kind of onesie-twosie how we started this and it didn't work then? So what makes you think it's going to work now?
Well, again, local communities can make their own decisions. We're looking at things statewide in terms of containment, in terms of mitigation, and then, of course, the distribution of a vaccine. Of course, it is useful if different counties communicate and collaborate in their areas, and so some may do that, some may not. We'll be taking a statewide perspective, and we'll be looking at options to ensure that Pennsylvanians certainly have access to their healthcare systems. We're watching the numbers. That's why we started with the numbers in the hospitals and the healthcare systems. And so we're going to be watching the healthcare capacity really, really closely. Other states have had significant challenges in terms of their healthcare capacity, such as Wisconsin, North Dakota, South Dakota. We're going to be watching ours really closely.
Next up is Jen Rahill. Jen, you have gotten a request to unmute yourself.
Hi, thank you, Secretary. We are looking at college students. We're in the Lehigh Valley, and there's a lot of colleges here. What do you recommend for college students who may be going home for the holidays or going home for the end of the semester? Should they be getting tested? What's the danger to the communities they may be going to?
So, there is a considerable risk for communities if, as students sort of leave their colleges and go home. And we do recommend that they get tested before they go home. So I know that many colleges have the capacity to do that, and many communities do. So it would be very prudent for college students to get a test before they go home. If they are positive, then they should quarantine where they are. They should isolate where they are if they have a positive test.
If I could ask a follow-up, it's on a slightly different topic, but that has to do with PPE and supplies. As we're seeing case counts spike all over the country, do you have any concerns about PPE availability here in Pennsylvania, and what's the plan for that if it becomes hard to get again?
Well, we have been working very hard over the last number of months in collaboration with the Governor's Office, the Department of General Services, PEMA, to purchase and collect PPE. So we have a very good store of PPE for the state. We know that hospitals and health systems have been doing the same. So they have their stores of PPE as well as long-term care facilities. And of course, the federal government has been storing PPEs. There could be challenges in the future. I mean, I know the federal government was hoping for a summer renaissance and a very, very quiet summer as they stored more and more PPE. Summer didn't turn out to be like that in the South and the West particularly. So PPE was used. So, I mean, we always need more PPE, but we have significantly increased our stores and stand prepared.
Next up is Paul Go from Pittsburgh Business Times. Paul, go ahead.
Thank you, and thanks, Dr. Levine, for taking the time. The recent focus has been on reminding people of their personal responsibility, and yet the numbers continue to go up. And we have the holidays coming, cold weather. I hear in the statement, it was in Allegheny County yesterday, Allegheny County Health Department, a lot of frustration about what people are doing or not doing. What's your thoughts about that? And also, is there a red line for you to move into other mitigation, other kinds of things moving forward?
Sure. Well, we are concerned, and we do call upon people to show that collective responsibility for themselves, their family, and their communities, and our whole Commonwealth. And so that is why that I have that message over and over again, and that other officials do. We call upon really all local officials, state officials, and national officials to come together now that the election is over and the people have spoken. We need to stand united about these simple public health measures. This is not a political issue. This is not a partisan issue. This is an urgent public health issue in Pennsylvania and throughout the state. What we're going to be watching is, of course, the numbers in terms of new cases and the percent positivity, which is critically important, both statewide and locally. But as I mentioned, we're really watching our hospital numbers, and we're going to look at all options to ensure that Pennsylvanians have access to hospitals and to medical care. And we're going to be working with the hospitals and the health systems and the healthcare collaboratives and the hospital association to make sure that they stand prepared for the number of cases that could occur with COVID-19.
I just have one quick follow-up. With the news of the Moderna vaccine today, is that impacting anything of what Pennsylvania is planning to deliver the vaccine, given that this is going to be a room temperature compared to the other one with freezing?
Sure. So Moderna is not at room temperature. It has to be refrigerated, or if it's going to be a long time, to be in a regular freezer. But you're right. The difference is that the Pfizer vaccine is ultra cold chain. It has to be at minus 80 degrees Celsius or centigrade, and that is significant impact upon its distribution. So we are working overtime in terms of being prepared, and Pennsylvania does stand prepared to distribute and then administer the vaccine and vaccines as they come to us from the federal government. Both the Pfizer and Moderna vaccine still await their review by the FDA and their emergency use authorization. Then they'll be reviewed by the CDC for guidance. And then when they come to us, we will administer and distribute them. There'll be differences in terms of how the two vaccines can be distributed because of the difference in terms of the temperatures that they will be at. But it's a very promising sign about both the effectiveness of the Moderna vaccine and the Pfizer vaccine. Very, very hopeful signs.
Okay, next up is Liz Kilmer from WPXI.
Dr. Levine, thanks for your time. Two questions for you. So we're hearing from folks in our area that it's taking a longer and longer amount of time to get test results back. So I'm wondering if we are in a position now where some of those labs are becoming overrun. And then second, in terms of hospitals being overrun, when do you think we could reach that point if we continue on with cases increasing in the way that they are now?
So you are correct. There's an increase in terms of the lag time to get test results. That's true nationally. It's because of the number of tests that are being done and then sent to the commercial laboratories, as has happened before. We have ramped up our testing significantly. We are getting now an average of 45,000 test results per day, and actually many days over 60,000 test results per day. That's a combination of the PCR tests and the antigen testing. But as the entire country is now showing increases and is increasing their testing, it is straining that system. So we will continue to work with all of our statewide and national partners to do the best we can to keep the testing going and to limit the lag time as much as possible. What we can control is our state lab, and we can get our test results back in 24 to 48 hours. There are also more and more point of care tests, both the antigen tests, and there's also a point of care PCR test. So the more that those are distributed, the better. We're hoping that the FDA will be able to approve more and more point of care tests, and those offer significant advantages as well. Your second question? If you could repeat that.
Yes, so it was in terms of hospitals being overrun. At what point could that happen if we continue seeing cases increase in the manner that they have been?
Well, we want to work to make sure that the hospitals don't get overrun. And so we really want to empower the hospitals, the health systems, and the regional coalitions, the healthcare coalitions, to really all work together. Again, we're all interconnected, and the hospital systems are all interconnected from that point of view. We need to make sure that people get the medical care they need for non-COVID related illnesses, but we need to make sure that the hospitals have the capacity to take care of the increasing number of COVID patients that we're seeing. And so we're pleased to work with them. We're pleased to work with the healthcare, the coalitions and the hospital association to make sure that we don't get overrun.
Next up is Tom Ford. Tom, you have been requested to be unmuted.
Thank you. Thank you, Dr. Levine. The last week or so, you've been talking a lot about how people need to resume avoiding small gatherings as well as larger ones. I'd like you to talk a little bit more about that, because over the last month or so, a lot of municipalities, a lot of businesses have resumed in-person meetings adhering to the 25-person limit. Should they be considering scaling back or going back to online meetings? What would you think?
Yeah, so we are concerned about even small gatherings, and we really, as much as possible, want people to remain within their household. So in terms of businesses, yes, we do call upon more teleworking and businesses on platforms such as this. We are asking businesses to do that. And we want people, in terms of the gatherings, especially as we approach the holidays, to really make the sacrifice to have the gathering within their household only, and to interact with their friends and their families remotely. I know that that is an enormous sacrifice over Thanksgiving, over Christmas, over Hanukkah, over Kwanzaa, over New Year's. But that's what we need to do as we stand united to be able to stop the spread of this virus. Whenever you are interacting with people outside of your household, there is a risk that you're going to be able to spread COVID-19. Many people are asymptomatic. They're not doing it deliberately. They don't know, they don't have any symptoms, and they don't know they had COVID-19. But really, case investigations and contact tracing throughout the country, as reported through the CDC and other venues, is showing that it's not just large gatherings, it is small gatherings in this community spread of COVID-19, which is fueling the increases that we're seeing throughout the country. So this is a national message. That's what we need people to do.
Okay, our last question will be from Jamie Bittner from Fox 43. Jamie, you've got a request to unmute.
Hi, Dr. Levine. Quick question for you. Today, New Jersey's governor announced more restrictions. Virginia putting in more restrictions today. New York putting in more restrictions. I know the governor has been in close contact with the governors in those states. I assume he shared some of those conversations with you. Can you provide us with any guidance that you are giving him, and any concerns you have of, especially during the holiday, people from those states coming into Pennsylvania? Do you think they're taking enough action?
Well, so there are multi-state discussions that the governor and the governor's office are having. Those discussions continue, so there's no specific announcement from them. But yes, I mean, we really want people, I mean, we have a large list of states where we want people to really not visit, and then really caution our residents from visiting them. If they're going to visit, then we want people to consider quarantine or maybe consider getting a test. But before they come, many states have implemented things like that. So we are concerned about travel-related spread of COVID-19. And, we have these extensive lists, but, almost every state now is starting to show up on the list. So really, it really highlights the message that we want people to stay within their household as we approach the holidays. Nothing concrete yet from those multi-state discussions.
Thank you so much, Secretary. That is all the time we have today. This recording will be available through PAcast. If you have follow-up, obviously, always feel free to contact the Department of Health Press Office. We're always here to help. Thanks so much, and have a safe day.
Thank you.